Welcome into Body and Soul right here on 938 Live. Thank you so much for joining me. I'm Daniel Marion. Today's topic, it's going to be very unique and a wonderful approach. I'm so glad I have the opportunity to talk about rare diseases. In fact, there is a Rare Disease Day. It's progressively become a world event. The U.S. joined in 2009. We've got patient organizations in 56 other countries participating. And last year, Singapore made its debut, in 2012. This year, Singapore is making its debut recognizing Rare Disease Day as well. Why is there a need? Well, it's been said there's been an increase in cases of rare diseases in Singapore, especially in recent years, which have led to the setup of the Rare Disorders Society Singapore, or the RDSS, in June 2011. Taking a page from Rare Disease Day 2012, we want to help you understand what's the nature, symptoms, and the possibility of an occurrence of rare disorders in your family. Our guest on the program, Dr. Ee Shien, is a consultant from the Department of Pediatrics at Genetics Services at KKH, and we're going to find out all about some of the rare diseases in Singapore. Dr. Tan, welcome to the program. Thanks for joining us. Let's talk about rare diseases. I was going to ask you kind of an antithetical question, but bear with me. What are some of the more common rare diseases we see in Singapore? I know it's odd to ask it that way because rare by its very nature is not very common. But what are some of the rare diseases that really, in your mind, stand out?
Well, most of the rare diseases are genetic diseases. Similarly, in Singapore, countries use the definition of about 1 in 2,000 people. If you have a disease that occurs only in that frequency, you are considered to have a rare disease. And one of the more common, so-called common ones would be muscular dystrophies, which affect the muscles of the body in a progressive nature. And some of the more uncommon ones that we do see but are equally important in our society are the metabolic disorders.
I see. Okay, muscular dystrophies and metabolic disorders. Let's find out more about them in just a moment, but let's still take an overview. I mean, when you heard about Rare Disease Day yourself, did it make a lot of sense to you for there to be a recognition of rare diseases?
Yes, I think so. Most people would not even know about these diseases, and even if you mention them in a conversation, most people give you a rather blank look.
Yeah.
And I think that having a Rare Disease Day is very important for the society to recognize that these conditions do exist in Singapore, not only in Western countries or in other populations, but in our local population as well.
I think so many people, especially, they might feel if they have a rare disease, that nobody kind of understands it, and that can have a social impact sometimes.
It's really difficult when when you tell a parent that your child has this certain condition and they don't understand it, and it's even harder when their entire family or their relatives do not understand it, and their friends have not heard of it. So there's very little empathy for such diseases.
I think that's the key point. You hit the nail on the head. I see exactly what you mean. By that same token, if it is a rare disease, is it harder to get expert treatment for a rare disease? Because we know that, how you're trained in your specialties often reflects, what is a common issue in your country, what not.
Well, it's true that in many cases the diagnosis is delayed purely because many doctors may not even have seen such a condition before, or may just have heard of it or read about it sometime in their medical school days. So most of our patients do come after maybe 1 or 2 years of seeking treatment, and it's hard to recognize such diseases.
It's very frustrating as well, having to go doctor to doctor to doctor.
It's very worrying, and of course they get more and more anxious, and it's totally understandable because they present with very non-specific symptoms. For example, a child with Pompe disease, which causes enlargement of the heart, can present with just heart failure, and there's so many other more common causes of heart failure, so they do have to search for the correct disease.
That's right. Okay, so unfortunately sometimes a little bit of persistence on the part of the family is important, especially I really do feel, I've heard from some families who've had rare diseases in the family household, and they said they always knew that the diagnosis just didn't fit, like something else was missing. So sometimes, they're following this kind of sense about it, and I'm sure that kind of dogged persistence is important, because following on to my next point, how successfully can we treat some of these issues? You mentioned, muscular dystrophies and metabolic diseases as well. We're going to detail them in a while, but can we treat them well? Just because it's rare doesn't mean it's untreatable.
Sure. For example, I think let's take metabolic diseases, for example. We can treat many of the complications quite easily, meaning that if it causes heart failure, for example, we can treat the heart failure quite easily with medication, but that's not ideal. We do not want to treat the complications. We do want to treat the root of the problem. And so when you talk about therapies that actually target the root of the problem, that's where it gets difficult and it gets expensive. So therapies like that do exist, things like replacing the enzyme that is deficient, or gene therapy, or bone marrow transplant. These are all expensive procedures. We do have some patients that are undergoing enzyme replacement therapy, but it's quite unaffordable in the long run. So that's one of the problems that these patients do face.
We'll find out more about rare diseases in just a little bit. We're recognizing Rare Disease Day 2012. Dr. Ee Shien joins me. She's a consultant from the Department of Pediatrics Genetics Service at KKH Hospital. Stay with us on Body and Soul.
Thanks so much, Daniel, and we will resume that conversation in just a moment.
Body and Soul.
Welcome back to Body and Soul on 938 Live. We're talking about rare diseases on today's edition of Body and Soul. Rare Disease Day is being recognized in 2012. 57 odd countries are recognizing it this year. Singapore made its debut last year and is doing so again this year. It's very important to focus on these because even though, yes, it may be rare and very few people might have it, it is the impact on that person is enormous, sometimes in terms of financial constraints, obviously in terms of physical and health issues, but also in terms of social issues, because it's difficult to deal with something that nobody really knows anything about. Dr. Ee Shien joins us. She's a consultant from the Department of Pediatrics at the Genetics Service at KKH. Dr. Tan, earlier on you mentioned it is quite common to see that families might have gone from doctor to doctor before arriving at the diagnosis of the rare disease. By that same token, because they are rare, it's quite easy to miss, you would say.
Yes, most definitely so. And they do come with very varied and even common symptoms.
Yeah.
For example, a child can come with recurrent vomiting episodes. Most people think that, it could be a gut problem, it could be the stomach, it could be the intestines, but some of them actually have a disorder that doesn't allow them to metabolize protein well. So when they take their milk, they start to vomit because they cannot metabolize the protein. But of course people would go for the common things first, and most rightly so. So it does take time before the actual diagnosis is made.
So I noticed you mentioned a lot of these rare disease cases as, being in infants and in young children. Would a rare disease most likely have to manifest at a very early point in life?
Not necessarily, but a great proportion of them will manifest as infants or even in children. Even in adulthood, some of these diseases do start appearing only at that stage.
I see. Okay, it all depends, of course, on the kind of disease that we're talking about. Overall, Dr. Tan, I said in my introduction that we're seeing a rise in some of these rare diseases. Would you agree with that assessment?
Yes, I think so. Not because the disease itself is increasing in numbers, but I think there's just increased rates of diagnosis. Number one, there is increasing awareness among physicians about these conditions. There's also increasing awareness among the population because the internet is so available to everyone, and someone who Googles their symptoms,
Google any disease.
Yeah, they can come up with the disease name itself.
Some websites claim to diagnose you as well. I worry about that.
Well, that'll put me out of a job.
So it's really about awareness, people coming forward and saying, I think it might be this, and finding their way to the best diagnosis.
I think it's perseverance. When you don't have the right diagnosis, to keep going and to keep searching. And ultimately, I always tell the parents that you know your child best. We have maybe thousands of patients under us, but you have your one child. So you would really know your child best, and you'll be the best advocate for your child.
Coming up, we're going to talk about some advice that Dr. Tan might have in terms of what you should do and how you can raise your awareness about some rare diseases. She's a consultant from the Department of Pediatrics Genetics Service at KKH Hospital. We continue with Body and Soul just ahead. Stay with us on 938 Live. Welcome back to Body and Soul on 938 Live. Thank you for joining us for a very important edition. We recognize Rare Disease Day 2012, and we're talking about some of the rare diseases that we do see in Singapore's climate as well. Dr. Ee Shien joins us. She's a consultant from the Department of Pediatrics Genetics Service at KKH Hospital, helping us understand the social, physical, and emotional impact that rare diseases can have on individuals and families. Dr. Tan, at the beginning of our discussion, you said that some of the rare diseases that we see in Singapore include muscular dystrophies and metabolic disorders as well. I want to talk a little bit more about metabolic disorders in particular. Why do you think it's important for us to raise our awareness about these?
Well, metabolic disorders are actually a group of quite many diseases. Basically, this group of disorders consists of diseases whereby the body is unable to metabolize certain components of food, simply like fat, protein, carbohydrate. So, because they lack certain enzyme ability, so the patients cannot turn the food into energy, or they cannot get rid of the toxic waste materials.
Which is the fundamental, process sometimes.
Yes. So it's amazing. Your body actually metabolizes thousands of things at one go, and you don't actually pay attention to them. But when one of it doesn't work, that's when the problem occurs.
What proportion of the population could experience some kind of metabolic disorder?
We started a newborn screening program for such disorders, meaning that when a baby is just born, we do take a blood spot to look for these diseases, even when they are asymptomatic. And we have actually found that about 1 in 2 to almost 3,000 will actually have a metabolic disorder. So it's actually more common than we previously thought.
That's not as rare as I thought it would be, actually.
Yeah, so 2 to 3,000, every 2 to 3,000 people, you get one.
How would these manifest, I wonder, metabolic disorders?
Well, it's a very wide variety. If they cannot metabolize protein, for example, some of them actually present with vomiting after they take a huge protein load. Let's say you take a couple of steaks and then you actually develop the recurrent vomiting. Or some of them actually present with heart failure, some of them present with liver failure, some of them present with muscular problems. So it's very, very varied in its presentation.
I can see why. Some medical professionals might even say that I can't find a reason for, it could be idiopathic for some people, they might think.
Definitely, because if you think about it, the body's metabolism is very basic and affects every organ system. So every organ system can be involved.
How do you finally diagnose something like that?
After much search.
Is it a process of elimination?
Yeah, we actually, of course, we look for the more common diseases first. And when those all turn out to be negative, then we start to think about those that are rare. And then we do the relevant testing, which is now available in Singapore. So the diagnosis rate is also improving.
I think that's why a lot of people like that TV show where they look for rare diseases. It might raise some awareness, hopefully. Who knows? Let's talk a little bit more about getting the right diagnosis. If what you just described is the process that most people go through, how do we diagnose better is my question.
So 2 ways. One is, of course, the screening program is important. To catch them when they are asymptomatic means that you catch them before any damage is done. So I think having that test done at newborn period is very important to screen for these metabolic disorders.
But we have to know what to screen for, though, right? There are certain markers that we know to look out for?
So we have actually developed a panel of tests whereby 1 drop of blood you are able to diagnose about 30-odd disorders. So earlier when I mentioned that the frequency was 1 in about 2 to 3,000, it's a collective number, meaning that, out of these 30-odd together, it's 1 in about 2 to 3,000. So individually they are quite rare, but collectively they are not that rare.
I understand. Okay, so screening programs, if they do exist, are a huge boon. If not, are there certain specialists? Are there rare disease experts that exist, I wonder, that we should consider?
Well, most of them actually first see the primary physician, meaning they go from the family doctor to the most relevant specialty. For example, the child has vomiting, so they'll be referred to the gastroenterologist. And subsequently, when they investigate and they're suspicious, then they get referred on to the genetics service, and we do see these rare disorders.
Okay, Dr. Tan, I've got a little bit of time to squeeze in a little bit about this muscular dystrophies. Actually, I'm glad I do, because I do know actually personally 2 people that do have muscular dystrophy issues, and it is, I mean, I don't think it's as rare as the metabolic disorders in the sense that at least people have some awareness of it. How do we treat muscular dystrophies that you mentioned?
Well, once again, muscular dystrophies are many. There are many types of muscular dystrophies, and in terms of treatment, a lot of it is actually physical therapy and basically supporting and exercising the relevant muscles. And there are some medications that can help to slow down the progress of the disease as well.
Does having a rare disease, like some of the things that we've just described, shorten your lifespan necessarily?
Not always. Some of the rare diseases are progressive and they can shorten the lifespan. Some are not progressive, they are just stably so for the lifetime, and some of them we are able to control quite well with medications, and therefore the lifespans are not affected.
Okay, we want to find out more about the awareness that can be raised from things like support groups and campaigns such as Rare Disease Day 2012. We're going to talk more with Dr. Ee Shien, consultant from the Department of Pediatrics Genetics Service at KKH Hospital, about rare diseases when Body and Soul continues on 938 Live. 938 Live. Welcome back to Body and Soul on 938 Live. Thank you for staying with us. I'm Daniel Marion. Taking a page from Rare Disease Day 2012, we here on the program are recognizing the range of rare diseases that can exist. Just because it's rare doesn't mean it has somehow less of an impact. It has an impact on the quality of lives that individuals are leading, on the families that are trying to cope with getting a diagnosis and finding the right course of treatment, which in some cases can be expensive and difficult to accommodate into your lifestyle as well. We've talked about the importance of screening programs that can play a part of sometimes knowing your child, knowing your family member, and doggedly pursuing sometimes the best diagnosis if you feel that you haven't reached the best solution. Rare diseases are, by its very nature, rare and needs to be found out in some cases with a bit of expert investigation. Our guest on the program, Dr. Ee Shien, joins us. She's a consultant from the Department of Pediatrics Genetics Services at KKH. Dr. Tan, let's talk a little bit more about awareness issues. We started off the program taking a page from Rare Disease Day 2012, as I mentioned. What more needs to be done to raise awareness of these rare diseases, in your opinion? A lot of people know a lot about cancer because of campaigns. A lot of people know a lot about diabetes because their grandfather or their uncle might have it. That might not be the case with a metabolic disorder or a dystrophy issue.
Well, that's why days like Rare Disease Day and simple campaigns, even this media interview, is very helpful, because they simply bring this group of rare diseases into the path of ordinary folk who may not actually have experienced it or have never even heard of it, even in their families or among their friends. And so even if it's simply for the crowd to know that these diseases exist, it's important. And maybe out of this crowd there will be a few who would take it a bit further to understand the disease, to understand the families and what they face, and from there they may be increasing support just simply from increased awareness about this disease. After all, that's one more person than yesterday who knows about it. Well, hopefully after today's interview, a lot more. A lot more, hopefully, as well. Where can we go? Is there any... I know that there's a Rare Disorder Society Singapore, the RDSS. Are there resources and online that we can go and read about it at the website, perhaps? Well, this society is set up by the families of some of these patients with rare diseases. They have a website. They also have some pamphlets, and they do organize some events to kind of raise awareness about these conditions. I know that the support network is very important. Support groups have been shown to be very useful for people going through the procedure, because it's always good to mutually learn from one another and to empathize with one another. Is that the core of what the RDSS does, support network? Yes, and also because it's so rare, individually the diseases are so rare, it's only in a collective group that they actually have a voice. So as opposed to one parent just telling the story about their children. It could be a group of families, and that's a louder voice for society to take note of.
I wonder, have you had any experience because working with an individual or a family who's had a rare disease and how their journey through it has maybe left an impression on you?
Well, I do work with these patients almost daily. I would talk about this family who actually set up the Rare Disease Society. It's set up by a family with a child with Pompe's disease, where the child actually initially had some delayed development, found to be a bit slower in the motor milestones, and subsequently noticed to have an enlarged heart, and then later on diagnosed Pompe's disease, and she's currently receiving enzyme replacement therapy, and she's actually done very well on the therapy. And so for this family, I think the diagnosis was important in order for them to gain the adequate treatment, and they have actually come together with some other families to set up this society.
That is very good to hear. I mean, to be moved by what other people could consider a tragedy, and to gain a sense of activism from it as well to help other people, that's a wonderful extension of an experience that you're going through. I wonder, we often do see, reports of family members needing to raise money because we know that cost is a big issue. Is there anything that we can do to help or to bring down the cost of these treatments?
Well, I think that when more and more people know about the disease, and also when there's more diagnoses made and it's not so rare anymore, naturally costs will come down, and also because if there is more knowledge about it, hopefully there'll be more funding for it, even from charities, from the government, and just more people willing to chip in to support this group of patients. Rather
than remaining invisible.
Definitely so.
Untouchable in some cases as well. Dr. Tan, I'd like to thank you for your time today, but just as we end off, I wonder, this year with Rare Disease Day, will you and the members of the RDSS be doing anything in particular? Is there something that you would like us to remember as a message for this year's Rare Disease Day?
I think they're coming together on Saturday in Orchard Road to give up balloons and have a party, basically. And hopefully passerbys will come by and do notice some of the things that are going on. And I like the motto of this society. It says that love is not rare. And I think that really is very well said, that even if a disease is uncommon and you don't see it often, it does not mean that the child is not important.
That is a wonderful message. On that note, thank you for your time today. My guest is Dr. Ee Shien, who's a consultant from the Department of Pediatrics Genetics Service at KKH. Thanks for joining me, Daniel Marion, as we joined our friends in recognizing Rare Disease Day this year. I'm Daniel Marion from Body and Soul.